I'm sorry, the Type Medical Instagram page is giving me problems. I don't know what's going on. Instagram is obviously messing my account again. So I'm going to do the backup on here today. I'm also going to post, or let me post on the page. So I'll post this full thing after this so you guys can see it. If you guys are just getting on here, welcome. If you guys know who I am, Big Irishman Hawk Squad, what's going on? Nice to see you guys as usual. And I'm going to start pushing everybody to the Type Medical 2.0 page. That way we have a backup just in case the original page has issues or problems or something's going on. We can have somewhere else to go to, and at that point we can have the conversation. I don't know if they just don't like some of the things I've been putting out or what it is, but it's okay. We'll get around it one way or another. What's going on, Rotten Rob? Ben Greer in the house. What's going on? How you guys doing here? Welcome to Titan Talk Tuesday. So it's going to be a good Tuesday either way, I promise you guys. And if you guys are just joining in, some of you guys I don't know for the first time, I appreciate you guys. All right, so let's talk about the first thing we're going to talk about today. Do you need help in the fight against fat? So our Injectable Ares is here. Key ingredient is Semaglutide. So it's really, really key. This is the first one that I've ever seen as far as FDA approval that has hardly any contraindications and really doesn't have any stimulant effect whatsoever. So that's a plus, because most of the things that came out that have been FDA approved for weight loss usually have some sort of stimulants in it, like phentermine or fen or all these other different things that have came out before. So it's a big, big thing. What's going on? John 89, big shout out to all the people that are in the Type Medical Center 60-day transformation challenge. And I know some of you guys are in here. Big Irishman, Rotten Rob's in the house, John 89, what's going on? So Rotten Rob said the Aries definitely works, and that's what we're talking about today. So if you guys seen before, we brought out the oral Aries therapy, right? And the main ingredient there was semaglutide. And you had to take this at least every other day for it to work. Well, we've got the semaglutide Aries injectable therapy now, which is a game changer, and it's even better than the oral version out there. You only have to take it one time a week, which is a beautiful thing. And it helps in a number of different ways for patients out there, especially patients that can't have stimulants and stuff like that, because, listen, they might have a low tolerance to stimulants, they might have cardiovascular issues or problems or whatever it may be, and that's where semaglutide really, really takes the cake. You know, with semaglutide, it's a beautiful therapy because it does a lot of different things, right? So basically, it helps with like stomach emptying. When digestion slows down, nutrients of the food release more slowly. This prevents blood sugar from spiking after a meal, and that's key, guys. Like, you know, sometimes if we eat high carb meals or high sugar meals, our blood sugar spikes tremendously. That's our body trying to work, you know, and balance things out. And sometimes that's not a good thing, right? Well, this is going to just help that issue out, right? And it's going to help with hunger problems as well. So a lot of people have issues where they can't control their eating habits, right? So at this point, this is going to help control your eating habits as well. Glad to be here to learn about this new therapy. This is a game changer, guys, especially for people that want weight loss. Now, it's FDA approved, like I said, and, you know, with that, they're talking about 5 to 10 to 15% of total body mass getting lost in this. And this is without any exercise or anything. But don't use it as a crutch, all right? I never want to say that to people because they're like, oh, I don't have to work out, I don't have to diet, I don't have to do this, I'm going to lose weight. Awesome. You really want to incorporate all those different tools in there. And obviously activity and your nutrition program, which people call diets. I call it a nutrition program because those are the nutrients you're fueling your body with and that your body obviously needs to, you know, to do its thing and to work optimally, because that's what we want it to do, right? So with that, it also increases insulin production. Helps your body make more insulin. The insulin release after a meal when your blood sugars levels rises, so they can combat these blood sugar issues and make sure you don't become insulin resistant. That's another big key word out there that a lot of people talk about. After that, you know, reduces sugar release from the livers. The liver can release extra sugars into the blood as needed. Prevents liver from putting too much sugar into it. So that's another big one out there. We don't want more sugar released into the bloodstream. We don't want high sugar levels in the bloodstream, right? So this will actually lower hemoglobin A1C to a healthy level too as well. So if you're up there and you had high glucose levels, or you were pre-diabetic or on the verge of it, and if you're overweight or obese, you know, there's a lot of people that fall into this category. Even if you're not, right? If your nutrition plan is not there, these levels can be affected, and this puts everything back into balance, which is a beautiful thing. It gets things it gets sugar out of the bloodstream and puts it directly into the cells. So it's actually called a GLP-1, a glucagon-like peptide 1. That's what semaglutide is. So a lot of people out there are looking for weight loss therapies, and this one, like I said, takes the cake. The beautiful thing is there's really hardly any counterindications. So when I talk about counterindications, when we talk about ECA-SAC Plus, which is phenomenal, I take every day, a lot of patients take that. But like I said, if you have high blood pressure, or you have cardiovascular issues, or you have low tolerance to stimulants and you can't do it because you feel jittery, anxious, and have problems, this is a therapy for you, where it's not going to give you any stimulant effect whatsoever. It's not going to increase blood pressure. It's not going to cause cardiovascular issues or anything like that. So it's really, really a game changer. But on the flip side of that, you can use other therapies with Aries therapy. So let's say you want that extra boost of energy, right? You want more energy. You want to be able to knock it out more in the gym, have more go. You can take ECA-SAC Plus with semaglutide. You can take AOD 9604 with semaglutide. Any other therapy goes along with the injectable or the Aries therapy. That's the beautiful thing about it. And the only counterindication out there, because there is thyroid issues, right? So if you have thyroid cancer and stuff like that, then that's the only counterindication, thyroid issues. But if you have no thyroid issues, and a lot of patients don't, this is for you guys. Now, if you have hypo or hyperthyroidism and it's getting controlled and stuff like that, this still does not affect that, and you can utilize that therapy with this one too as well. Top tier tactical training in the house. What's going on? My man Antonio, what's going on? So if you guys are looking for something to help you guys get those New Year's resolutions out in front of, and you guys want to lose weight, then semaglutide is going to be the therapy for you guys. I appreciate all you guys tuning in. Like I said, once again, I'm sorry about the regular Instagram page. So you know what? I was like, listen, I'll just go on this personal page where I think I got some followers. I haven't really been trying to build these pages up, but now obviously because of this problem, I'm going to start building these up. So I want you guys to go to Titan Medical 2.0. If you guys are seeing this on the Titan Medical Center page, that is the official backup page for Titan Medical Center. Titan Medical 2.0. And then this is my personal page for Instagram out there, Tsikouris J. You guys can look it up, and you guys will have my personal page, which might not all be Titan all the time, but a majority of that stuff is Titan Medical Center. But I share some of my personal stuff on there that I wouldn't share on the Titan Medical Center pages because I want to be professional and make sure that, you know, it's all content oriented to what Titan Medical Center does. And on the other page, I might throw some other personal stuff up there. So you guys will get a little behind the scenes peek of what I do daily, maybe. You never know. All right, so Festival Speed recap. Festival Speed was done in St. Petersburg at Vinoy Park this last weekend. It was phenomenal, guys. A lot of great cars out there. It was actually the most cars, I think, that have been at one of these events. And we've been doing it, I think, for 4 years now. And at that point, it was 400 vehicles, 400 cars. That is a lot. And it was totally packed all the way around. Obviously, we had our great Titans and Titanettes out there. We had Destiny out there. Eva's out there. Angelina, you know, me, Big Drew. We had the staff out there. Big Art was out there getting some great behind the scenes. Jay Jacobs get my photography and photos from that. Me and Sharice were out there obviously representing. And Sharice had her own special part where she was the interviewer of some of these people that won their awards, which was really, really cool. You know, she years loses their medical license and has to do a psychic evaluation for COVID falsehoods. So I thought this was interesting out there. Obviously, we've been doing almost 3 years in this pandemic thing with COVID, and it's taken all types of different ways. People, react all differently when we talk about this subject. It could affect different people in different ways. Some people may have lost people, some people don't. Some people think it's crazy, it's a pandemic, and some people really have went through this and they're dealing with the pandemic. So just wherever you stand at, this is kind of crazy because this doctor had a temporary suspension of her medical license. She had her medical license in Maine, has her practice in Maine, and she basically got it suspended, and they wanted a neuropsychological exam of her before they even talked about reinstating her license. And this was some of the different things that happened with it. It's going to be with a regular insulin syringe for the Aries injectable therapy. It's not some big, huge needle. You'll actually take it with an insulin needle and you'll inject it in the subcutaneous fat in the belly area. It's real simple and easy to do. It's virtually painless. So you guys will all get a whole bunch of positive effects and hopefully no negative ones at all. The negative things as far as that goes is if you take too much, okay, you could have gastric issues, like you have to go to the bathroom a lot, right? Or it could make you nauseated in some circumstances. But on the regimen that we have our patients on, you aren't going to get that and you're going to tear up. So over time, you'll take more medication. But right off the start, all the medication, you don't have to take it one time to get great results. If you do the tier process like we have it and prescribed, you'll get amazing results and have no negative side effects, hopefully, okay? All right, so back to this doctor that lost her license. So she basically had to do a psych evaluation, and at that point, her license is suspended. And you're gonna ask why, okay? Usually the doctors that have their license suspended or taken away forever, it's really hard to do that usually. It's really hard to get somebody's license taken away forever, right? For the suspensions of license, these happen usually for medical malpractice or a whole bunch of complaints coming to a medical provider through the board of medicine in that state usually, and then each state will go after the physician or put them on somewhat of a trial type thing where they want you to come in front of a board of your peers and explain yourself of why you did what you did and what happened. So this doctor really, Dr. Meryl Nass, got her license in Maine in 1997, and it got immediately suspended for 30 days after a board investigation review of complaints against her on January 12th. She had a couple different complaints about her. Some of these complaints said that she was spreading misinformation about vaccines and the pandemic. And then the other complaints were that she was basically prescribing non-FDA approved or authorized medications to patients. And some of these different things, let's talk about it because you probably heard about them. So one was hydroxychloroquine. She prescribed this to a patient that was pregnant at the time, and at that point, now hydroxychloroquine in the original first year of the COVID-19 pandemic did have FDA authorized emergency use. And then what happened? It was a political thing, things went up in the air, and at that point what happened was some of these states said it was illegal for them to even prescribe hydroxychloroquine to patients, and that hydroxychloroquine had no benefit whatsoever and such, and all these different things. It came into a political scandal, which sucks, right? It sucks for patients out there, medical providers out there, because the patients are the really ones that get hurt. Now, whether this was the right thing to prescribe to that patient or not, I'm not here to make that judgment call. Ivermectin was another thing that she prescribed out that a lot of people are prescribing out there. It just depends on what state you're in if they're allowing you to do such a thing. So Maine was a big one that really cut back on hydroxychloroquine and really went against ivermectin. So there's a lot of them out there, right? Because like ivermectin is used for like tapeworms and stuff like that, where hydroxychloroquine is used for like malaria. These are antivirals, okay? And, there are some very popular people out there like Joe Rogan that, really, really promotes ivermectin. He said he was on ivermectin. Aaron Rodgers said he went on ivermectin. If you guys don't know who he is, he's the Packers quarterback that said he was vaccinated. He's really unvaccinated. But a lot of these different people have been taking these medications. Now, ivermectin, when the media got a hold of it, said that ivermectin wasn't used for human use, which is false, right? It is FDA approved for certain human things. So at that point, the misinformation there is that, yes, ivermectin can be used for animals too as well and to treat different things like tapeworms. But it also is used for human use and consumption. It does have an FDA approval, not for COVID-19, but for other things. And hydroxychloroquine is the exact same thing. People were taking hydroxychloroquine way before COVID-19 happened in this pandemic. So at that point, there really should be no issues with this. But like I said, it became a political thing. Now the things with doctors, let's talk about that, right? I'm going to give you guys a little peek behind the door. Again, where doctors are practicing medicine. And it's exactly like that. That's why doctors can't guarantee anything, right? Usually you fill out forms and stuff like that where liability gets taken away from them because they are practicing medicine. It's continuously practicing, right? So yeah, pain pills are another big thing out there, and we'll talk about that, Hulk Squad. But so at that point, they should be able to prescribe whatever is in the patient's best interest on what they believe, and they talk to the patient about the possible risks and the benefits of what this medication is going to do. This is with all medications. That's with testosterone, that's with antibiotics, all these different things out there. Whether you're getting one medication or another, the physician or medical provider should talk to you about the benefits, the risks, and are the benefits outweighing the risks of you taking this medication? Is it really in your best interest to take this medication? And then you as the patient decides, yes, listen, I'm going to follow my physician's orders. I think this is going to be the best route for me, and that's the way they go. It should be between the medical provider, the doctor or medical provider, and the patient. That's their decision, right? Now, obviously, if a medical provider is really cuckoo for coconuts and prescribing things that we really shouldn't be prescribing to people that could really, really hurt people, then maybe it should be getting a different look, right? But for these medications right here, they are tolerated very well by patients. And at that point, there is more ongoing research on these medications with patients. Because really, guys, there's nothing out there that's stopping COVID-19, okay? No vaccine has stopped COVID-19. No boosters have stopped COVID-19. It just keeps rummaging and going through our population and the world over and over again in different forms of variants. From the original COVID-19 coronavirus to what we have now on Omicron and now a stealth BA2 is what they call it, BA.2, which is the subvariant of Omicron, and it's called the stealth variant. And the reason they call it the stealth variant is because now they're saying that it's hard to detect it through PCR, not through rapids, but through a PCR. And that's kind of scary, guys, because we really won't know who has it and who doesn't. Which goes into the next thing where, there's different countries out there right now that are loosening or getting rid of COVID-19 restrictions. The UK is one of them. Basically, it's letting down all the restrictions, masks and all this. Now, of course, they want people to be vaccinated and such, but people that are vaccinated or even boosted are still transmitting this virus. They're still getting this virus. They're still getting hospitalized, and people are dying from this. They're not showing that people that are vaccinated and boosted aren't dying or having breakthrough infections because that's going on. All right, I know personally on all these different things. First go around, I had COVID-19 asymptomatic. Son was asymptomatic. Sharice was in the ICU, right? Let's go down a couple more months, maybe another year later. My cousin died of COVID-19. I was literally by him when his son, who was 18 years old, had to make the decision to pull him off the ventilator because that was the only thing that was keeping him alive. Okay? So I went through that, right? And then with Omicron now, me, Sharice, my son, and my dad all got sick, really sick. Flu-like symptoms. I was still fine. I wasn't deathly ill. I didn't have to go to the hospital. I didn't go to the ventilator. I didn't need monoclonal cocktails or anything like that. Sharice getting through it, but some of her symptoms came back from the long haul, neurological issues. My son is over it. My dad is still sick, right? He's getting better, I think, day by day. But man, he's lucky that we had everything at his disposal to be able to treat him the way we did. If he was a regular person, it might have got a little worse for him, okay? Because COVID-19 is one thing, viral, right? But it's the secondary infections that really, really come after people, right? And do some harm. And even with him, vaccinated, both shots, boosted the whole time. I felt bad because obviously he might have caught it from me or one of the people that came in the house. And we don't have too many people over, but he doesn't go anywhere. So I kind of feel bad on that, but he's getting through it. I think he's almost over it, thank God. and I'll be praying to God that he does. Booty God, what's going on, my dude? Power Belly, what's going on? How you doing? All right, so Hulk Squad said, my ex-wife has MS. We went to an international known neurological doctor. Dr. Smith, he's prescribed Celcep. It was the only medication that stopped her lesions, and the state came after him for prescribing it. It's crazy, okay? The patient should have the right to take any medications. I thought there was a law that Trump put in place before, the Right to Try Act, I believe it was, where they could try these different things. I don't know if they had to be terminal or not, but listen, if it improves the patient's quality of life, that's between the patient and the doctor. The medical provider and the doctor are the same thing, but they should be between that and the patient. Whatever they decide is the best treatment plan, they're comfortable with going forth, they should be able to do it. And for the state to come after them for something crazy like that is ridiculous. And like you said, like our pain pill, we still have an epidemic of pain pills. Deaths were on the highest scale than they ever been this last couple of years because obviously, you know, it was a lot easier to get a hold of pain medication, just being honest with you guys. And people were more depressed than ever, isolated, couldn't go by people, didn't know what was going to go on, maybe lost their job, all these different things that happened out there. You know, so I mean, pain pills, I mean, before you have to go, like here in Florida, you have to go in the office, it's tracked every 30 days and such. Where is now with the pandemic and everything, because of COVID, you know, doctors didn't want to have people in office, everything closed down, so on went telemedicine. And that's fine, right? Because some of these patients really, really do need the medication. But a lot of patients don't, and they're abusing these medications, and that's what's causing these issues. Non-FDA-approved medications, he was put out of business. My ex-wife had to use another medicine, which didn't work as well. That's horrible. It really, really is. Now, you know, with medications like that, right, a lot of doctors use medications for off-label use and never get in trouble for doing it, right? It's because they think that's the best thing for the patient, and that's what they utilize. It's just become a witch hunt for some of these medical providers out there, you know, to prescribe some of these things, and people are really looking at it. Like I said, people are taking sides, and I believe it's a really political thing. I don't believe it's a personal thing. I think it's a political thing, and if they do it, they're automatically on one side if they prescribe this medication or the other. It's really, really crazy what's going on. Even here in Florida, the FDA, right, just relinquished or took back the use of monoclonal cocktails because they say it has no bearing on Omicron as the variant and no help. It's funny they say that because I was just at my dentist yesterday, right? Sitting there, got Invisalign in here, I got these damn things in my teeth. First time ever, I'm like, what the hell? So he's talking to me, you know, Jewish guy, real nice dude, and telling me he just got Omicron. And luckily he got the monoclonal cocktails, and he said he was good like literally afterwards, a day afterwards, he felt like $1 million. So to take away something that possibly could help people in a good way and has helped people all the way up to this point because they think it doesn't work for the Omicron variant, I don't know about this, guys. It's really, really crazy. I mean, they've been saying all these different things help for coronavirus are going to make you not get coronavirus, and all of a sudden this has changed. So really this data is changing every day, and we're all living through this, which is nuts. Sucks we have to live through this, guys. I apologize, but you know what? I tell my son every day I'm really sorry because I never thought in a million years he would have to go through this time in his life. Growing up, I never thought something like this would happen, right? It's crazy. John, I have to go to work. Thank you, boss. I appreciate you, dude. Trust the process, man. Keep working. Love it. All right, so my uncle got his hydroxychloroquine taken away that he'd been taking for 8 years for goiter. And my granny, hers taken away for rheumatoid arthritis because of Trump mentioned it. Wow, you know what? It was really crazy because even when, you know, the political thing came out and Trump backed hydroxychloroquine, and at that point, the other side and other people did not like that and really went after the drug. They said it was used for rheumatoid arthritis and lupus and such, and they said they were going to keep letting prescribe it for that. So I'm really sorry to hear that those medications got taken away. Victor, what's going on? Thank you. I appreciate it. And thank you for all your knowledge. That's why you guys are all rock stars. Thank you so much. Hawk Squad said, I feel it was insurance influence because it was a big ordeal to have insurance cover it. So that is the big deal, right? If insurance is going to cover a drug, it's got to be FDA approved. They will not cover something that's not FDA approved. If it's for off-label use, they don't like to cover that either. You know, so that's a big, big thing, right? Insurance companies don't want to cover things. They will do whatever they can in their possible power to not cover medications or visits or whatever they can. Whatever they can get out with, they're going to get out with. But, on the other flip side of that, maybe if you did out of pocket, then there wouldn't have been as much issues or problems. There never is because, when you get into billing with insurance, this is why Titan Medical Center doesn't do it, is because they can look at things 7 years in the past and come after you or try to come after you for these different things that you did. So at that point, that's why it's all cash pay here. You can do more with the patient. There's less restrictions. People don't understand, why does insurance cover these things? Like blood work. I could get blood work from my general practitioner out there. I'm like, yeah, you can get general blood work done. General blood work. I'm not talking about you getting all the hormones, IGF-1 levels, food sensitivity testing you want. You're not just going to get that, right? And that's why we do out of pocket, because we don't want our medical providers to have any restrictions for our patients. Whatever they think is the best regimen and routine for them, that's what we're going to go with. And there's not going to be fighting with the insurance companies. Should we do this? Not do this? You guys need to run these tests and all that. It's garbage, guys. It's a lot of hoops, and it's bad for patients. Straight period. Glad you guys are feeling better. Continue to feel great. Thank you. We really are, man. And we're feeling a lot better. So thank God. Yeah. I feel insurance may have been the whistleblower, and it definitely probably was. They will do that a lot of the different times. All right, guys. So the next thing, we're talking about body shaming. So body shaming is not good and should not be taken lightly either way. So me and Art were talking about this earlier because I was going through topics the last couple of days, and I try to find the most interesting topics to talk to you guys about. And I don't do really lifestyle topics as much because I say that for Friday for Big Drew. So I'd like to talk to you guys about medical things or therapies or things that that are advancing and stuff like that. But this was a big one because this has been happening a lot lately. So me and Art were talking about this with body shaming. And body shaming used to be a one-way street before, I think, where body shaming used to be, skinny people making fun of fat people, okay, or overweight or obese people. And it's flipped the script tremendously now. So now we have morbidly obese people making fun of people that are thin or skinny, right? These people might have an eating disorder or something else that might have made them like this. And we don't even take that into consideration. Now, like I said, it goes both ways. I've heard, skinny people or in shape people call people fat, you're a fat ass, excuse my language, all these different derogatory and negative comments, which I don't think are good at all. I mean, at this point, I think that we should be boosting people up. If they're obese and they're overweight, I think, we should be giving them motivation. If you see them in the gym and they're only walking, at least they're doing something. They're on their way to progressively, hopefully, getting better and losing that weight. Because I don't think that people that are overweight and obese want to be. I really don't. And I don't think a lot of them are comfortable in their skin. I really don't. It's crazy because, I see a lot of these people that they're trying to take it up, and now magazines are putting them on the front. This is healthy. And these people are morbidly obese or unhealthy looking. And at that point, I just think that, they want to be and they can't. So, you know what? They own it. They own it. They go on there and say, listen, this is what it should look like. I'm healthy. I don't care what you little skinny twigs out there think. I think that's wrong. I think that we need to incorporate a healthy look. And I don't think that a jacked guy that's, 300 pounds, 6'3", could be healthy either in some people's eyes. I think that, people look at what is healthy in a lot of different ways and scenarios. But I don't think that people that are obese or unhealthy looking, in my eyes, should be making derogatory or negative comments on thin or skinny people. It's not right. Even I see some of the overweight people talk about some of my friends. I see some of their posts like steroids or, I could do that if I'm on steroids. I would like to see some of you guys try because it's not that easy to do, especially when you're so far down the rabbit hole, it's hard to come back from that. Gaining weight, I think, is a little bit easier than losing weight. Because in gaining weight, you just increase your calorie count and you're going to start gaining weight. Unless you have some medical issue, like a thyroid issue or something like that, you're probably going to gain weight. And this could be done in a number of different ways. From you just going and eating 10 cheeseburgers a day, you're probably going to put on weight. It might not be good weight, but you're going to put on weight. And it's harder for people that are maybe a little bit overweight or obese because they're going to calorie restrictions. So they're used to eating so many calories and not doing so much activity possibly, and having to turn that around dramatically. But I don't think it's right on either side to be condemning people or saying negatives or derogatory things to them. I think that we should be rooting for people. I think that positivity should definitely outweigh negativity, especially right now with what's going on. I think we're more divided than ever as a country, as a planet. I think that, just people are taking sides left and right for all different types of things, whether it be political or vaccines or, how you look, if you're overweight or you're too skinny or whatever it may be. People that have eating disorders or eating problems can be on both sides of the spectrum. You have people that are overweight or obese, they have an eating issue that might be emotional, might be triggered by something else, but they're eating so much and this makes them or helps them cope with different things. Where you have skinny people or very, very skinny people or people that are anorexic that are having other eating disorders. We've dealt with this forever, as far as females especially, wanting to look like the magazine picture and trying to get thin as however they can, right? Whether it's eating just one meal a day, whether it's a salad and then throwing it up. I mean, there's a lot of different things out there. So I'm really scared for people out there when they do this. So I think, when we see this thing, we need to put a stop to it. And people are doing this whichever way or method. I think we need to put a stop to it because, listen, everybody out there, I think, we're all different, okay? We're all going to have different body types, sizes, ethnicities, nationalities, all these different things come into play, right? So at this point, I think that we should put these things aside, and we need to be truthful, okay? We do have certain indicators of obese or overweight people, and some of the things that come along with that, all right? Health issues and problems like high blood pressure, cardiovascular disease, diabetes, which is on a rise. And at this point, I think we really need to look at that. And listen, that's not healthy. We don't need to put it up on a pedestal and make everybody, I know we're in the inclusive era, but we don't need to make everything inclusive where everything is fine, because it's not fine, okay? Everything's not fine. And if it was, we'd all get together and we'd all hold hands and there'd be rainbows all over and we'd have no problems. Obviously people think different ways, so things are not fine out there. And I think that we need to do whatever we can in our power to bring positivity and encourage people. So if they're overweight and obese, say, listen, you should do this. If people are straight up saying, listen, I'm healthy and I'm 1,000 pounds, there's obviously some problems with that. And I think we coddle some people in that light in this generation or in this era, and I think we need to cut that shit out. Just being honest with you guys. All right. I love to give first bump to the bigger people because they took the step. Yeah, it's a big thing, even for overweight people to step in the gym or to get out of that comfort zone. Even skinnier people and stuff like that, like they want to gain muscle sometimes too, or they want to get bigger. And the common thing for bodybuilders out there, so you guys know for guys, if you guys don't know already, you come from a certain point, right, where you might have been thin or skinny or whatever it is, and you've gained a whole bunch of muscle or whatever it is over time. But when you look in that mirror, you see that skinny person in the mirror, okay? It happens to a lot of guys out there, and they never think they're getting big or bigger or whatever it may be because they still see that person in the mirror. So it's hard for them too as well. So I think a lot of people deal with it mentally. It's not just obese people or skinny people. It could be people that look phenomenal. But, one person says, oh, you look like you lost some weight. And, man, they're in the gym. They're hitting it 10 times harder. They're eating 10 times more food. Because to them, that's not a compliment. That's actually tell them, oh, man, you look skinny. And they don't want to be skinny. That's the whole point to it. So it's crazy. So just, when you're saying stuff to people, it can affect them, all right? It can affect their mental health and affect their physical health too as well. So let's try to be positive out there. And, to the keyboard gangsters out there, take a break, all right? Nobody wants to hear it. All right. So 60-Day Titan Transformation Challenge is in its third week. I am so proud of everybody out there that is in this and doing this. Especially for you guys. You guys are posting the photos on your page. Big shout out to you guys. That takes a lot of guts to do that. You're putting it out there for everybody to see. But you know what? You guys are motivating people. More people than you guys know. You guys are really, really, it's something to be proud about, man. I mean, I know a lot of people are writing me in there like, man, like this is awesome. Like, because people, they don't do that, especially on social media. They show the best of the best, and that's all they ever want to put out there. They never put out, something that, makes them vulnerable. And that, to a certain extent, I think that makes people vulnerable, like putting themselves out there like that. but it makes you stronger too, because you really don't care what people think at that point. And now you're really doing it for yourself. And you're going to show people how much you guys can change. And I'm really excited. I've got a surprise for everybody that's in this contest. So I don't care who wins this contest. Everybody is going to win something out of this. I have a special surprise, and I don't want to give it away before the end of this contest, but I'm super excited for all you guys. And I'm going to help you guys no matter what, even after the contest. You guys will see. Big Irishman says, I still see the skinny old me crazy. I think everybody does, even Drew, right? Drew looked at me like, man, like, am I big enough? I'm like, Drew, trust me, dude, you're big enough, right? You always got to tell him, because he wants to hear that. That's words of encouragement to him, right? So, let's be more about that words of encouragement. If you see people on posts that are doing that, tell them to make a stop to it. Why don't you say something positive to somebody instead of something negative? It's real easy to say something negative. And I always go back to the old saying, right? If you don't have nothing to say, don't say anything at all. That's how it should be, man. I don't think, unless somebody say negative something against you and you have to be brutally honest back to them, or you need to defend yourself in some way, shape, or form. I kind of understand that, but don't give in to some of these keyboard gangsters out there too. They're not worth your time. Block, move on, right? That's what it's all about. So guys, the Titan Weekly newsletter poll. This one was awesome. Would you try our injectable Ares therapy if you knew it would work? Yes, I would. 68.1% said that. Well, guys, it works. It definitely works, 100%. We obviously know this because of patients. We know this because of the data out there. It's tremendous and overwhelming as far as what the data says and what our patients are experiencing from it. And the oral version was one thing. The injectable is going to be a whole different ball game and really, really going to get people results like you would not believe. So I can't wait to see all you guys' results, especially some of you guys are in this transformation that are using it. You guys can utilize some of these tools we have now to win this transformation. And like I said, either way, all you guys are going to win something. All right, so the next one was, yes, I already ordered it, 12.8%. So you got some people that are already on this and are trying to win it, or maybe not even the contest and just want to lose weight that have been using this. Been really good. No, but does it really work? 10%. Yes, it works. Okay, we can actually say that because of the FDA approval in the clinical studies. It's a beautiful thing. No, I don't need it. 8.5%. So understandable. Some people out there don't want weight loss. Some people are fine where they're at weight-wise. They want to gain more muscle, or they just want quality of life, right? They want to improve energy, sex drive, concentration, feel good every day, and that's all right too. Not every therapy is for everybody out there. People have different goals or different things they're trying to achieve, and that's what we're here to do. What's going on? WM Vaughn, what's going on? How you doing? So at that point, we really want to make sure that our medical providers, our staff, we're aligning with your goals, and we're creating a regimen or treatment program that are going to get you there the fastest and the healthiest and safest way. That's another thing. Health is number one priority. We never give you something that's going to hurt you and maybe get you the result. Who cares about that short-term result if it's going to damage your health long-term? It's not worth it at all. I talk to people every day about this, especially the younger guys out there, even some older guys that don't know what's going on. They ask a buddy at the gym, like, hey, dude, what do I do to do this? And they tell them, 3 different things usually, and the most common things I would say. You need testosterone, which you might very well need to be, but you should be monitored and checked after and get the blood work beforehand. Have a medical provider. Have it come from a real licensed pharmacy instead of maybe a bathtub, right? Or from China, all right? You don't know what the hell's in it and what the hell you're getting. And if you get found with that, right? Let's say somebody's searching your bag or somebody stops you and you're having your car, whatever it may be, and they find it, that's a controlled substance. That's a felony charge right then and there for you guys. It's not worth it, right? The other thing out there is trend. I would stay away from trend. I'm just being honest with you guys. I know a lot of people use it. I don't really even like to talk about it on here because it stirs a conversation that I don't want to talk about or don't want to be in. This is made for animals. It's mass gainer. It's not really good for people in a lot of different ways, from your cardiovascular health to just daily quality of life, right? This could affect different things and make you angry and another different things as far as night sweats or, maybe wrecking relationships, business relationships, personal relationships, romantic relationships. So this is just something that stays along. I hear some other ones out there, but, the thing about it is these people are just spouting off different compounds to tell you, or they want to sell you. And at that point, this might not be the best route for you, or there might be a whole different route that might be a hell of a lot healthier that you guys are getting monitored and get from a real pharmacy, okay? So just keep that in the back of your brains, and really, you want to give people good information out there. I've known, because before Titan Medical Center, listen, guys, I know all types of dudes in the gym. I've been through all that stuff. I have all different types of friends, competitors, all the way up to Mr. Olympias and down. So at that point, I've been through this industry for a long, long time. And I know and I see it a lot of different times. Luckily, a lot more people are more educated about hormone replacement therapy, about some of these medical weight loss programs. The internet is out there, so it's good and bad in some ways, because if you look some things up, it's obviously going to tell you good information. But if you're not really combing through credible information, you're getting bad information, and that's teaching you a whole different thing or telling you something that may be wrong. So just take it for what it's worth, guys, okay? And make sure you guys are really, really researching things if you want to learn about something, and you're getting from credible sources out there. That's the other thing. There's a lot of uncredible sources out there and a lot of disinformation out there, so you guys make sure, especially now, more than ever, guys. So, guys, I think that's it. I know, listen, this is another thing I want to reach out to you guys. I'm giving away 2 VIP Gasparilla tickets. I'm going to have to do it on our lives. I'm going to do it on our Facebook Live, because I think that'll probably be the biggest one at this point. I'm also going to do it on here. So I'll do it on here, and I'll do it on Facebook and YouTube as well. So if you guys are in the area and you guys want 2 VIP tickets to the 93.3 VIP tent, which is going to be in the center, in the middle of the Gasparilla Parade. My friend Brian Fink, who's going to be hosting that event for 93.3 and iHeartMedia, is going to be there and be the MC of the event in that tent. It's going to be awesome, VIP stuff. I think they're going to have food, maybe some drinks and stuff like that too as well. Yeah. And you'll get to see everything dead center. And if you guys have never been to it, trust me, it's one hell of an experience. I give these tickets away almost every year.
We got to do it tonight because they need a list of VIP, because you got to have your name on the list to get in. And
gotcha. Okay. All right. So we'll decide this here in a little bit and what we're going to do as far as how we're going to pick the winners. So if you guys are interested in that, just let us know. Text, and I'll give you guys, just write us a DM or a text, and I'll let you guys know where to tune into so you guys can be a part of that giveaway as well. Yeah. All right, guys. Make sure you guys are checking out titanmedicalcenter.com. A lot of new information on there. All the therapies are on there. It's updated. If you guys haven't been on there in a while, please go check it out. And if you guys are interested in anything that Titan Medical Center does, we can help you guys out all around the country. From HRT, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers for males and females, peptides, healing peptides, sexual peptides, weight loss peptides, right? Blood work nationwide. All these different things we can help you out with. All you guys got to do is call or text 727-389-3220, and we'll be happy to help you guys out. I appreciate you guys switching over this page. Like I said, they restricted my live for today, so I couldn't go on the Instagram live on the Titan Medical Center. So please, guys, go to Titan Medical 2.0. That's all you got to type in. And please go follow that page, like that page. And we'll be having some shows on there if we need to for a backup. But I'm creating that backup page so we can get everybody over there just in case something like this does happen. And we can just switch over there with no problems. And it's Tuesday. What's going on? I hope you're doing well. So if you missed out, I see you just joined in. We talked about the Injectable Ares Semaglutide, which I know you took the oral version. This one is a game changer. It's going to do a lot more. And you only have to inject once a week with a little insulin pin right in your abdominal area and the fatty tissue, and you guys will get amazing results and curb your hunger as well. Plus, it will help insulin levels in your body work the way they should, okay? So that's it, guys. I appreciate all you guys tuning in. I'm John from Titan Medical Center. I appreciate it, and I'll see you guys next week, hopefully on a regular page. But if not, let's do this backup page, get everything going there at Titan Medical 2.0 or Titan Medical. I'll keep you guys briefed, and I'll do like a trial to see if I can do it on the page beforehand. I appreciate all you guys for tuning in. I'll see you guys Friday with Titan Lifestyle with Big Drew, 2 p.m. every Friday. Thanks, guys. I'll see you later.